Hello, I'm Dr. Toby Mayer. I practice here in Beverly Hills and have been doing facial feminization on transgender patients for more than 30 years. Our goal has always been to achieve a natural, non-surgical, balanced appearance, not that surgical look with little upturned noses and asymmetry in the face. Gia, who's been my patient with transgender facial feminization, is here to help other transitioning girls learn what's involved and to tell her experience of exactly what she went through.
I met Dr. Mayer about 10, 11 years ago after doing a lot of research online and just through friends and people I knew. His name kept popping up as one of the best facial feminization doctors out here in Beverly Hills. And after meeting with him and meeting his staff, I became very comfortable here at his office. And that's when I decided to have him do my facial feminization. I've had quite a bit of work done, but his amazing work is that you can't really tell. It's very important to look natural when you're having facial feminization. I think that's the key thing that Dr. Mayer has perfected.
So if we look at Gia's before and after pictures, one of the things that we do in most patients is a hairline forehead lift. That's a procedure that we invented more than 30 years ago. And through that incision, we're able to do bony orbital contouring, cutting the muscles that we need to remove the lines. We could lower the hairline, which we did for Gia. And then we can fill in, if they have deep recessions, as Gia did, we can fill those in with a few micrografts. But you notice the hair grows through the scar, so you don't see any scar, whether it's in a picture or in person. The patient always needs to look balanced. So we want cheek implants because you see before she didn't have enough cheeks, so we want the cheeks to be more prominent, which especially is one of the things that's very important to women in transition. And then we shave the Adam's apple face so that we don't have a prominent male appearance of the Adam's apple. Some surgeons remove this part of the bone of the jaw, but if you look at Angelina Jolie, Keira Knightley, you see that they are just as prominent as this. You don't need to remove that. If we narrow this area, what happens is we make this look too wide. And with the head, we can't change the head size, so everything has to be balanced. Most patients do not need anything removed from the angle of the mandible because that does not feminize someone, it just makes them look unbalanced.
When I came here, I remember being really nervous, and obviously the procedure might have been a little bit scary. But once you go through the process and your face starts healing, you start seeing the changes. I think that it does amazing things for you, self-esteem and confidence, because especially after the the forehead reduction and the brow bone shaving, the nose job, it really made a huge difference in my profile and just how the way I felt. I just felt a lot more feminine, and as you can see, I'm very happy.
My name's Jamie, but 21 years ago, I was born as James Sullivan. I am a girl trapped in a boy's body.
So Jamie, in her transition, had facial feminization where we shaved the Adam's apple. She had filler put in both cheeks to increase the size of the cheeks. She had a hairline forehead lift with bony orbital contouring, and then she had her lips augmented, as well as having her nose straightened and refined. If we look at this picture, you can see a much more feminine look with her the bone shaved and her brows raised, as well as better cheek prominence, straighter nose, and more refined, so it doesn't look quite so masculine. She's had her voice modified, which is a procedure that I developed more than 30 years ago. And you can go to our website to see her journey and listen to her voice. You can tell that this patient has a very prominent Adam's apple, which has been shaved because this is quite masculine appearance. She's had her nose done. She's had soft tissue put in this crease. She's had the bone here shaved, so you can see now it's smooth. Here it was quite masculine. And she's had a forehead lift as well because her brows are too low here, and that gives someone a masculine, tired appearance. As you can tell, we've done a bony orbital contouring, we've done her nose, and if we look at the frontal view, you see the nose is refined and made more feminine. It doesn't look pinched, it doesn't look too narrow, it's not too upturned. It makes her much, much more feminine. And in addition, we've done a hairline procedure where we've shaved the bony orbital contour and raised her brows. Not so she looks surprised, but so that she looks natural when we're finished. And that's most important. She's had her lower eyelid bags removed as well, and she's had soft tissue put in her creases because they're quite prominent. This patient has had the same procedure that the other patients have had as far as a bony orbital contouring, shaving of the bone, and then raising the brows, as you'll see on the frontal. But she thought she would never have a full head of hair again. And you see that she's had a Fleming-Mayer flap, and this whole area has been removed and replaced with natural hair from the side of the head. So it's just as dense as it is here when we move the flap in place here. So she's able to have a full head of hair again. Once again, you can see the brows are depressed, looks a little bit sad. Not a great deal, just a little bit, so they're just peaked a little bit to make a more feminine look. But you see, this is a solid piece of hair that now is laid down at one time. You don't have to have multiple procedures of transplants. And it gives a much better texture and density. That's the Fleming-Mayer flap. As you see, with all patients, we would like to get a natural, non-surgical, done look. What we want is someone to be able to follow their journey into facial feminization without an abnormal look.